I went to a veterinary conference, so you don't have to. Cat edition. And I wanted to start with probably my most exciting thing that I learned there, and it was actually one of the exhibitors, Trivium Vet, and basically they have found what they think is a treatment for HCM in cats, or hypertrophic cardiomyopathy. And if I have any biohackers out there, this is a really cool video to watch because it shows the intersection of human medicine and biohacking and veterinary medicine. Differently than dogs, we don't have good medicinal treatment. The only treatment we really have is trying to preserve their heart function and things that they have by controlling blood pressure and things like that. But really it does have a pretty poor prognosis overall. So I was very excited about this. A little background, I'm just going to read you their, kind of little elevator pitch. Feline hypertrophic cardiomyopathy, or HCM, is a life-threatening progressive disease affecting up to 15% of cats. Despite the devastatingly high morbidity and mortality rates associated with HCM, it remains a disease with little therapeutic advancement. However, inhibition of the mechanistic target of rapamycin, or mTOR pathway, has been shown to prevent and even reverse cardiac hypertrophy in rodent disease models. They sought to evaluate the effects of 6 months of once-weekly dosing with TRIV202, which is an mTOR inhibitor, on echocardiographic, biochemical, and biomarker responses in cats with subclinical HCM, so early stage HCM, which is usually when we catch it. So this was called the RapaCat Feline Hypertrophic Cardiomyopathy Field Study, and it had 43 client-owned cats with subclinical HCM, which is stage B1 or B2 if anybody is familiar with veterinary cardiology. They were enrolled in a double-blinded, multi-center, randomized, and placebo-controlled clinical trial. Cats were allocated to low or high-dose TRIV202 or a placebo. Cats underwent physical exam, quality of life assessment, blood pressure, hematology, biochem, T4, urinalysis, proBNP, and cardiac troponin at baseline, day 60, 120, and 180. Fructosamine, which is kind of like hemoglobin A1C in people, was analyzed at screening and day 180. Echocardiograms were performed at all time points excluding day 120. No demographic, echocardiographic, or clinical pathologic values were significantly different between study groups at baseline, confirming successful randomization. At day 180, the primary study outcome variable, maximum LV or left ventricle myocardial or heart wall thickness at any location, was significantly lower in the low dose group compared to placebo. Once weekly inhibition of mTOR was well tolerated and may reverse or prevent progressive left ventricular hypertrophy or thickening in cats with subclinical HCM. Like, bruh. The implications of this study are pretty fantastic. Basically, this would change the whole world of feline cardiology, and they're also starting to extrapolate some of these theories to renal disease, which is killer of older felines. And, it honestly has implications in a lot of areas of human and animal medicine. It's a very, very, very exciting part of medicine, and human medicine, they're getting very excited about it because of the longevity implications. And we're also trying to get our cats to live forever. So they will soon be starting a study called the HALT HCM study, and they will soon be enrolling patients. And the only location I know that they'll be enrolling patients, but I know there's multiple. The one I'm aware of is NC State in Raleigh. So if you have any patients that are newly diagnosed HCM cats, please give your clients the number to the study. It's very exciting. What do you guys think?